Have you ever wondered why erectile dysfunction is becoming more common, even among men in their 20s and 30s? What if I told you that ED is not always about masculinity, age, or performance, and that many of the real causes are silently affecting millions of men without them even realizing it? Today, we're uncovering the surprising facts about erectile dysfunction that almost everyone ignores. Facts that could change your health, your confidence, and your future. Welcome back to Balanced Motion Health, the channel where we simplify men's health and empower you with science-backed solutions. If you're new here, make sure to hit that subscribe button because today's topic is one that every man and every partner needs to understand deeply. Section 1. ED is not what most people think. Most men think erectile dysfunction is only about not getting hard. But here's the truth. ED is not the problem. It's a warning sign. Your erections are like a built-in health meter. They can reveal the quality of your blood vessels, hidden heart problems, metabolic issues, hormonal imbalances, lifestyle stressors, and even early nerve damage. This is why doctors sometimes say ED is the canary in the coal mine. It often shows up years before more serious conditions appear. Story moment. I once read about a man who had been dealing with mild ED for almost a year. He ignored it, thinking it was just stress. During a routine checkup, they discovered early-stage cardiovascular disease. His ED wasn't a performance issue, it was a life-saving early warning. Section 2. Fact number 1. Most ED is caused by blood flow problems, not psychology. Hollywood and social media have made men believe that ED is mostly in your head. Yes, anxiety and stress matter. But here's what people ignore. Over 70% of ED cases are actually caused by blood flow issues. To get an erection, the blood vessels in the penis need to open wide and hold blood inside like a balloon. If your arteries are clogged, if your blood pressure is high, if you have high cholesterol or diabetes, if your lifestyle is damaging your circulation, your performance takes the hit. The surprising part. ED can be the first detectable symptom of cardiovascular disease. So instead of asking, why can't I get an erection? The better question is something affecting my blood flow? This shifts the whole conversation from shame to health awareness. Section 3. Fact number 2. Your emotional brain controls more than you think. Even though blood flow plays a huge role, your mind is the starter motor of the entire system. Your brain triggers dopamine, serotonin, testosterone signals, nerve impulses to the penis, and relaxation of blood vessels. Here's the surprising part. You can be physically healthy, but one moment of anxiety can disrupt the entire sequence. Think about this. You're stressed. Your brain releases cortisol, which narrows blood vessels and shuts down sexual arousal. This is not weakness, it's biology. The vicious cycle. You get ED once. You panic. Your brain becomes hyper alert. Performance anxiety kicks in. ED gets worse. Your brain starts associating sex with pressure. The cycle repeats. Understanding this alone makes many men breathe easier because the problem becomes less personal and more predictable. Section 4. Fact number 3. ED is often the first sign of diabetes. This is one of the most ignored truths. When blood sugar stays high, over time it damages the tiny blood vessels in the penis, the nerves that trigger erections, and the hormones that regulate sexual function. ED can appear 5 to 10 years before a diabetes diagnosis. This means if you're experiencing unexplained ED and you're feeling tired, gaining weight, or thirsty, your body may be warning you early. The good news? Catching it early means it's reversible. Section 5. Fact number 4. Low testosterone is not the main culprit. Most men think low testosterone is the number one cause of ED, but science says something different. Low testosterone alone rarely causes ED. It mostly affects low libido, low drive, reduced morning erections, mood changes, low energy. A man can have normal testosterone and still experience ED because erections depend primarily on blood flow, nitric oxide production, nerve function. The surprising part? You could have normal testosterone but still have symptoms because your body isn't using the hormone efficiently. This is called androgen resistance, something most men don't know exists. Section 6. Fact number 5. Porn-induced ED is more real than people think. This one makes many men uncomfortable, but it's important. Excessive porn, especially high-stimulus content, rewires the brain's reward system. What happens? Your brain becomes used to novelty. Dopamine spikes become harder to trigger. Real-life intimacy feels less stimulating. Your arousal threshold increases. Erections in real-life situations become weaker or inconsistent. The shocking truth? Many men under 30 with ED have perfectly healthy bodies, but their brains have been overstimulated. The good news? Brain pathways can reset within weeks. Section 7. Fact number 6. Your lifestyle shapes your performance more than your age. Yes, age matters, but lifestyle matters more. A 60-year-old man who exercises, eats well, sleeps well, and manages stress can have better sexual performance than a 30-year-old who smokes, drinks heavily, sleeps 4 hours, eats fast food, sits all day, never exercises. Your erection health is simply blood vessel health, and blood vessels respond dramatically to lifestyle habits. What improves ED fast? Daily walking, weight loss, quitting smoking, reducing alcohol, strength training, improving sleep, eating vegetables, fruits, fiber, fish, nuts. Yes, these simple things rebuild blood vessels and nitric oxide levels. Section 8. Fact number 7. Medications are often the hidden cause. Many men silently suffer from medication-related ED without knowing why. Common culprits: antidepressants, SSRIs, blood pressure medications, acid reflux drugs, antihistamines, some diabetes medications. The surprising part? Most men improve simply by switching medications under doctor supervision. Never stop meds on your own, but always talk to your doctor. Section 9. Fact number 8. ED is reversible in most cases. This is the most empowering truth. Research shows around 80 to 90% of ED cases are improvable or fully reversible. Depending on the cause, solutions include lifestyle changes, stress reduction, pelvic floor therapy, improving sleep, medication adjustments, testosterone optimization, managing chronic diseases, temporary use of ED medications, and newer technologies like shockwave therapy can help men with blood flow related ED. Section 10. A short story to tie it all together. Let's talk about Jamal, not his real name, a 42-year-old father of 3. He came to his doctor embarrassed, thinking something was wrong with him as a man. He discovered 3 things. His blood pressure was high. He was pre-diabetic. Stress from work was out of control. Within 4 months of making lifestyle changes, he lost 7 kilograms. His blood pressure improved. His confidence returned, and his ED resolved naturally. His story is one example of millions. ED isn't a punishment, it's a message. And when men listen to that message, they often change their whole lives, not just their performance. Section 11. Practical action steps you can start today. 1. Walk 20 to 30 minutes a day. Improves blood flow, nitric oxide, mood, and hormones. 2. Get blood tests. Check testosterone, HbA1c, fasting glucose, lipids, vitamin D. 3. Reduce porn use. Give your brain time to reset. 4. Improve sleep. Aim for 7 to 8 hours. Testosterone increases at night. 5. Eat like your heart depends on it, because your erections do. 6. Practice pelvic floor exercises. Strengthens the muscles responsible for erections. 7. Manage stress. Meditation, breathing exercises, and hobbies reduce cortisol. If today's video opened your eyes or taught you something new, make sure to like this video to help it reach more people. Subscribe to Balanced Motion Health for weekly men's health insights. Comment below, what's one question you want us to cover in our next men's health episode? Remember, erectile dysfunction is not the end of your story. It's the beginning of understanding your health in a deeper, more empowering way. Your body speaks. Your job is simply to listen. Thanks for watching, and I'll see you in the next video.